Do call in and ask all your questions on homeopathy on the show Hello Dotor between 6 to 7 p.m. on Friday, 9th September. Look forward to seeing you there. Namaskar. Hello, Namaskar. I am Dr.
नमस्कार. प्रुडंट मेडिचा हॅलो दोतोर कार्यान तुमकां सगळ्यांक मना काळजांसान येवकार. आज तुमकां सांगतना खूब खोस भोगता की आज आयच्या आमच्या कार्यावळी म्हणजे रौनक श्याम जी आसा ती एका व्हडल्या नामनेच्या फक्त भारतांतल्याच न्हय तर आंतरराष्ट्रीय ख्यातीच्या डॉक्टरा बरोबर होमिओपॅथीच्या तज्ञ दोतोरा बरोबर आसतली. तुमच्यानी आमकां कितकेशेच प्रश्न विचारूं येता. म्हाका खात्री आसा तुमच्या मनान सामके प्रश्नांचो असो पावस पडटलो. पण जो मनीस म्हजे बरोबर बसला ताची वळख आसा जाका आमी सगळे जाण डॉक्टर मुकेश बत्रा ह्या नांवान वळखतात. ताच्या पलीकडे ताची खूब एक व्हडली वळख आसा. ती करून घेतनाच हांव तांचे बरोबर उलयतलो आनी ही आसा तांची वळख.
डॉक्टर मुकेश बत्रा हाचो जन्म 1 जुलय 1951 लखनौ हांगासर जाल्लो. 1972 त्यांनी होमिओपॅथीची डिग्री बॉम्बे होमिओपॅथी मेडिकल कॉलेजींतल्यान मेळयली. 1974 मलाबार हिलाच्या चॅरिटेबल होमिओपॅथी क्लिनिकांतल्यान त्यांच्या कारकिर्दीची सुरवात जाली. त्यांच्यानी 1982 जगातले पहिले ब्रँडेड आणि कम्प्युटरायज क्लिनिक ओपन केल्ले. 4.5 पेशंटांक ऑनलाईन कन्सल्टेशन केल्याबद्दल डॉक्टर बत्रा यांच्या नावाची नोंद लिम्का बुक ऑफ रेकॉर्ड्साच्या 2004 आणि 2005 वर्साच्या एडिशनान केल्ली. 2001 त्यांच्यानी डॉक्टर बत्रास पॉझिटिव्ह हेल्थ फाउंडेशनाची स्थापना केली. डॉक्टर बत्रा हांकां भलायकी क्षेत्रांतल्या दिलेल्या योगदाना खातीर 2012 भारत सरकारान पद्मश्री दिवन सन्मान केल्लो. आयज मेरेन त्यांनी अनेक कॉलम्स आणि तशीच बुकां बरयल्यात.
तर इश्टानो, जशें हांवें सुरवातीकच सांगला, आज आमचे बरोबर आसात आंतरराष्ट्रीय ख्यातीचे सामके हुशार तज्ञ, त्याचबरोबर पद्मश्री अवॉर्ड विनर ऑफ 2012 म्हणजे 2012चो पद्मश्री पुरस्कार तांकां फावो जाल्ले अशे नामनेचे होमिओपॅथ डॉक्टर मुकेश बत्रा. आणि खरें सांगप म्हणजे ताची वळख जी आतां तुमी पळयली ती कांयच न्हय. इट इज नॉट इवन द टीप ऑफ द आयसबर्ग. कारण ही इज सच अ टॅलंटेड मल्टीफॅसिलिटेड पर्सनॅलिटी. ही इज अ सिंगर, ही इज अ फोटोग्राफर. तो बरयता, ताणें वाचता आणि कितकेशेच तांचे इतके हॉबीज आसा. दे आर रनिंग चॅरिटी क्लिनिक्स आणि एज आय हॅव मेन्शन अर्लियर इन 7 कंट्रीज मोर दॅन 225 आउटलेट्स ऑफ म्हणजे बत्राज क्लिनिक्स अवेलेबल आसात. तांचे बरोबर तांचे एक अनेक खाशेलेपण अशें आसा की बुधवारचे बिटवीन 10 to 12 इट्स अ फ्री क्लिनिक फॉर द पुअर पेशंट. एनीबडी कॅन वॉक इन टू एनी ऑफ द क्लिनिक ऑफ बत्राज एनीवेअर इन द वर्ल्ड ऑर इन इंडिया. तशें तांचे आनी एज आय हॅव मेन्शन अर्लियर फोटोग्राफी इज हिज पॅशन. ही इज अ व्हेरी गुड सिंगर. आणि हे सगळें करतना ही हॅज अ व्हेरी कोर कन्सेप्ट ऑफ वर्किंग फॉर द कम्युनिटी. फायनली वॉट वी गेट and what we remembered is what we offer to the society. हे एका व्यापक भावनेन काम करतना आपले सगळे जे मॅक्झिमम उत्पन्न आसा खंयच्या ह्या चॅरिटीच्या माध्यमांतल्यान फोटोग्राफी जावं सिंगींग जावं आनी कितें आसूं ते सगळे गरिबां खातीर किंवा भुरग्यां खातीर वापरपाचो मानस. आणि इतकेंच न्हय तर तांच्यांनी आतां अभ्यासाची सांगतना जस्ट लेट मी कम बॅक टू द अकॅडमिक बिकॉज इफ आय थिंक टॉक इवन इट विल टेक मोर दॅन 1 hour ओनली डिस्क्रायबिंग अबाउट दिस मल्टीफॅसेटेड पर्सनॅलिटी. ही इज philanthropist. He is very kind-hearted, he's generous, and above all, a fantastic human being and a perfect, I should say, homeopath. Correct, sir?
Thank you.
What is important, what I would like to say, कि आता हो तुमकां अशें दिसपाक लागलें only I am talking much. So let's come to the topic. Sir, we would like to know from you what you mean by homeopathy, because unless people know what is the foundation of homeopathy, they will not understand how the homeopathy works.
So thank you very much, Dr. Rao, and thank you for the wonderful introduction. And also for the short video clip. I'm saying I know that you worked behind my back to make that happen. Thank you very much. Let me start by saying that, homeopathy comes from 2 words, homo meaning similar and pathy meaning study of. So it's a study of similars in very simple languages. Let me explain this in another very practical way which is easily understood. We all know about vaccination, and it's been the buzzword today during COVID.
Correct.
We all talk about vaccinations. We talk about how when you vaccinate somebody, what do? You put a little bit of the bacteria or the virus into the body, and the body creates antibodies against it, and it builds natural immunity. This is exactly what homeopathy does. So you put in what causes in a healthy human being cures in a sick person. That's the philosophy of homeopathy. So for example, if you are cutting onions and your eyes start watering, if somebody gets a cold with running of the nose, watering of the eyes, if you make a homeopathic medicine from onion, it will help to treat and cure that person.
Oh.
This is very simplistically put. It's not that easy. But this is just for understanding. So I hope that this answers your question, doctor.
Yeah. So, doctor, as we go ahead, see, basically, ह्या कार्यावळीची मोखच अशी आसा की this program is designed in such a way that we are not only focused about only one particular branch, whichever serves the community to take care of the patients and suffering human beings. This is a concept. In fact, now I'm very happy that earlier, especially I'm saying when we talk about allopathy, like Western medicine or whatever, now in syllabus also we are having new syllabus where the introduction of homeopathy, Ayurveda, Siddha medicine, all these things are coming. So like in Ayush, earlier we always had a feeling that whatever comes in our textbooks is the perfect. But now we are also broadened our horizon, and finally it's all in the interest of the community.
That's a very, very good point, doctor, and I'm so happy to hear that today people are now talking about integrated medicine.
Correct.
And we also now talk about Ayush, and there's a kind of a separate ministry for Ayush.
Correct.
Which has been formed about 7-8 years ago in India.
Yeah.
And that's for the propagation of all alternative systems of medicine.
Yes.
I just say this jokingly, of course, that ऐसा माना जाता है कि बीमारी जो है इतनी अभी कॉम्प्लेक्स हो गई है, and there are so many diseases, so many new problems are coming up. I'm saying when I studied medicine almost 50 years ago in medical college, we did not know anything about chikungunya, we did not know anything about AIDS, we did not know anything about COVID. This was not taught to us. So there are new diseases which are evolving all the time, and therefore I believe that anything that helps human being and humankind, that kind of system is a good system.
Yeah.
So whatever suits you, whatever works for you, and as a joke I always say, whether it is allopathy or homeopathy or Tirupati, I mean just whatever works for you, use it for the betterment of society and for your own health.
So in short, I'll just add one more. Apart from all this, what matters is most is your sympathy. So that sympathy creates a better environment. Finally, we cannot say that this particular medicine will work the way it is working in 99 people. That one person may be different, and that one person, because finally we say like 1%, but 1% when the person is you or your relative, that makes a difference for you. Like say a person who has said, okay doctor, this person has operated on 10,000 patients, and all 9,900 patients, 999 patients are fine, but the one who has expired is my relative. And what are you going to tell people? So it is always, so there is one person who makes a difference than who he is. So accordingly, his medicines, his psychology, his temperaments, his philosophy, his understanding, his belief, everything comes into picture. Correct, doctor?
I would totally agree with you. I'm saying here what I would like to add here is that it's not just sympathy, but it's also empathy.
Correct.
Because it's there's a difference between the two.
Yes.
Sympathy, we say bichara.
Correct.
Empathy, we say, we feel for you.
Yeah. I can understand your feeling.
Yeah, I can understand your pain.
Yeah.
And I think
sensitivity.
if all doctors were to feel that every patient is a family member.
Yeah.
And if and let me tell you this also, that doctors make the worst patients from my 50 years of experience. So when doctors go to the other side and then they become patients, then they're not very patient. But when they're on the other side, then sometimes we have seen so many people and so many sick people that we tend to be a little harsh. So I think being sympathetic, being kind, being putting ourselves in other people's positions is very important.
Yes. So
I always say this, that medicine is a very, very exact science, and it's more exacting and more difficult than any other system of medicine, any other profession, if I was to use that word. मैं ये मानता हूँ ऐसे, we always say that a film star is as good or as bad as his last movie. अगर Friday को box office अच्छी चल गई, then his price goes up. अगर 3 box office fail हो गया, then the price comes down. But with medicine, you're as good or as bad as your present patient.
Correct.
I'm saying your 99,000 patients that you treated earlier make no difference to anybody.
Correct.
It's what have you done for me as a person.
Yes, absolutely.
And that's what you just mentioned. So I totally agree with you that that's very important.
That one person who is, that accordingly we judge, and then we say, अरे अच्छा डॉक्टर है लेकिन हमारा patient और मुझे I am not fit. So doctor, I think when we are talking about medicine, I would put a little, this today's show is a little in a different way, because before we start getting questions, I would also like to know about your other hobbies associated, apart from your academic activities, like you have written books for homeopathy people, you also started a course, you also started fellowship in dermatology in Association Mumbai University. So many activities you have done, but also I'm interested because finally, as you have mentioned, it is not only the medicine which helps the people. It's also our own approach to the public, our own approach to the life on a bigger sector, to be on a bigger horizon. So when I see a man of your caliber having a wide horizon, not a, I should say 360 degrees all around, you are seeing in whatever possible way, how you take life as, because now we are talking about all we are saying that today's diseases are lifestyle disorders. So what is your take on this?
So, I think the first thing is that, we must take care of ourselves.
Yes.
What is very important is that we always tend to think of good health as, like what we think of an accident. Or kisi ko hoga, humko to nahi hoga,
Correct.
And we don't take charge of ourselves. I also believe that, people go to doctors and say, you tell my daughter that she should not have lollipop or ice cream because she's getting tonsillitis. But you're the parent, why can't you tell that? So patients like to be governed. But I think in healthcare, you have to be self-governed.
Yeah.
That's a very important thing. You have to learn how to look after yourself. And this really comes from discipline. So discipline in healthcare is very important. I'm saying, for example, if you're talking about obesity or weight loss, I always say as a joke that the best thing that you can do is to nod your head from side to side. अगर खाना आपके सामने आएगा तो आप जरा ना कहिए उसको. If you're getting mithai and ice cream, you please say no and just control your diet. So I'm saying, this is what I'm trying to say, that a lot of it is self-induced, and therefore we need to control it ourselves and not really totally dependent on doctors to do it. Again, there's a preventive side to medicine which is very important, and there's a curative side. What we are doing is we're only looking at the curative side. We're looking at bimari ho gayi, dawai li, theek ho gayi.
Correct.
Like again I say ill, pill, will, bill. And then, whatever, bill and will. So I'm saying, that's really what we look at. But why are we not looking at health education? Why are we not looking at hygiene? Why are we not looking at environment? Because a lot of diseases today are environmental.
Correct.
They are because of water pollution.
Correct.
So if you are able to also look at the social dimension of health,
Yes.
the results will be far better. And if you look at health education, educating people not to spit on the road, educating people, not to have open defecation, I think a lot of good health will come.
Definitely.
So I think we need to look at health as a society,
Yeah.
and not as an individual person.
So, doctor, I think I have got one question on my mobile. The young girl of 20 years, in short, I'm just saying, her name is Reshma, and she's a student. Her basic complaint is a hair fall. She's saying she has already tried so many multivitamins and different types of oils available in the market, but nothing works, and hair fall keeps on growing. In fact, growing in the sense the amount of hair loss is tremendous, and she's very much apprehensive. What can be done about this? That is her question.
So, first of all, let me, get rid of your apprehension, Reshma. A certain amount of hair fall is normal. Even losing up to 40, 50, 100 hair every day is normal, because hair fall happens in a cycle. Hair has a cycle. It falls, it again stays steady, and then it grows back again. Now, this is a 3-year cycle. I'm not using medical words, but this is a 3-year cycle. Also, what you should know is that it's not a cosmetic problem. Hair loss is a medical problem, and there are 40 different reasons for hair loss. So unless you can get it diagnosed correctly, you cannot treat it properly. So you can't treat hair loss by just putting oils and going to parlors and thinking that now it will become all right. Yes, one of the reasons for hair loss is also nutritional deficiencies. I'm saying we found in women, particularly almost 60% of the major metros in India are anemic. So if you check the ferritin level, which is the level of iron in blood, and you find it is low, then yes, supplements do help. And then within a 3-month period of time, your hair will stop falling. But there are a lot of other medical reasons. I'm saying it also falls because of diabetes. You get a particular kind of hair loss, which is called alopecia areata, which falls in patches, which is an autoimmune disorder. It can also come because of stress. It can come because of the kind of water that you're using. If you're using too much of chlorine in water, if you're swimming too much. So there are a lot of reasons for hair loss. So it's not easy to just pinpoint just one reason. And therefore, it's good that you should go to a trichologist or a dermatologist or to a qualified homeopath and actually get yourself checked out. And let me also mention this, that in my practice of almost 50 years, I have seen lots of young girls who present with hair loss, and then they have little acne on the chin, and then they have little acne or little hair on the chin, little acne on the face. And when you ask them questions, they have irregular periods. When you do a sonography, you find out they've got polycystic ovaries. So PCODs are now also becoming very common in younger girls, and unless you treat that, your hair fall will not improve. So try to get to the root of the problem. That's what is important.
Okay. Thank you, doctor. But since you, in this explanation itself, you have opened another dimension, that is our PCOD. Because we, at least being in gynec and professional allopathics, nowadays what we have observed is that a lot of patients, young girls especially, are coming with PCODs. And this number is increasing day by day. Is one of the reason, if I'm not mistaken, is for infertility also. And cause maybe your diet, lack of exercise and all that thing. But I would like to ask you one thing, how your homeopathy approach towards PCOD or generalize this type of conditions?
So the first thing, of course, is to diagnose it correctly, because you want to make sure that just not on basis on symptoms, but also on pathology, that you're able to diagnose really, whether it's multiple ovarian, single ovaries, whether it's bilateral, what's the size of the cyst, and depending on all of that, the treatment gets started. But basically, the treatment is a constitutional treatment, which means really you take the entire history of the patient. You also see the mental frame up of that person, and according to that, you then start homeopathic treatment. So it's something which is deep acting, and then of course, after 6 months or 9 months, you do another sonography, and you see that the cyst has either reduced or disappeared. And once this happens, automatically then the symptoms also disappear. I mean, we don't believe that every case of polycystic ovary actually needs surgery, which is today done, very, very easily. I think a lot of it can be avoided, and we've got a lot of clinical evidence to actually show that with homeopathy, PCODs can actually be treated, and only rarely, when you don't get results, do you actually need to either operate or use hormonal treatment. So hormonal treatment also comes with a lot of side effects.
Absolutely.
So I think one should just be cautious. I'm saying homeopathy should be the first line of treatment for PCOD, and everything else should be the later line of treatment, not the other way around. What happens is people normally go for surgery or they take hormonal treatment and then they come for homeopathy. It should be the other way around. If you try homeopathy and it hasn't worked for you over a period of time, then you try something different.
Okay. Doctor, here there is another, it is a statement in fact I got. See, doctor, what we have observed is homeopathy treatment takes long time. And by that time, either the patient become irregular in taking his treatment or following the advice given by the doctor. So that is one of the reasons that the patients drop the treatment. So what is your take on this with current newer medications available in homeopathic practice?
So it's a very good question, and
this has come from one girl by name Sejal.
Okay. So Sejal, thank you for the question. It's a very, very valid and very good question, because one of the biggest challenges that medicine faces today, not just homeopaths or homeopathy, but the medical establishment as such, is something that is called patient compliance. So you can be the best doctor in the world, and you can tell the patient that aap ye dawai lo, but the moment the patient goes outside your clinic door and just throws the medicine in the waste paper basket, or goes back to Dr. Google or Dr. WhatsApp and starts consulting and then says, no, ye to theek nahi hai, I think I should be following this, or because my friend said so, therefore I should be doing this. I think it's a challenge. So it's a challenge in every system of medicine, and of course it is there also in homeopathy. Like I mentioned in the beginning, one of the biggest things that is very important in medicine is discipline. So you got to be disciplined. I'm saying, also what happens is in homeopathy, lots of people who come for homeopathic treatment come for chronic lifestyle problems, what we call NCDs. So non-communicable diseases like diabetes, hypertension, so on and so forth, skin problems, allergies, people come for homeopathic treatment. Now, these are long-standing problems. Absolutely. What happens is that these are people, they come to us for 10 years of migraine, for example.
Absolutely.
Then you don't expect that a 10-year migraine or a headache would get all right in 1 day or 2 days. Yeah. Now, you could take a pill and you could pop it, and the pain will disappear, but you're not treating the migraine.
Absolutely.
It comes back again. So when you look at, if you look at just one incident, and you say, I took a pill, it disappeared, you say, oh, it was very quick. But the fact is that you're suffering from migraine for over a 10-year period. It's so long. So you haven't got cured for 10 years. So if with homeopathy it takes 1 year and you get completely all right from the root, and it never comes back again, according to me, that's a fast cure. It's a quick cure. So I think everything in life is relative, and you should look at it from that perspective. So for chronic problems, you should give it enough time. I just give one thumb rule. I say, come se kam, for every 1 year of sickness, at least give 1 month of treatment.
Oh.
If you're suffering from a chronic problem.
Absolutely.
So if it's a 10-year problem, then at least you give 10 months.
10 months to
I think that's just being fair.
Yeah.
And that's a good enough reason. And of course, let me just also mention that in case you suffer from an acute problem, like a cold or a sneezing or a cough or, a viral infection, then the results are very, very quick in homeopathic treatment and you don't get side effects.
Oh.
So you actually hit the ground running. So rather than feeling weak after taking, antibiotics if you have a cold or a fever or whatever, and then, not being able to go to work for the next 3-4 days, with homeopathy, with acute problems, you can actually get all right very fast, very quickly, and without side effects.
Absolutely. So this is one of the punchline that sir has also already mentioned, ki when you are spending time of around 10 years with the same illness, maybe migraine or whatever it is, then you should also give minimum 10 months to get it cured. You cannot say, and nowadays what we have observed, doctor, that patient want quick relief. They want to, okay, take this one tablet. They are not going to do anything. Like, see, you ask somebody, doctor, I want to lose weight. But you tell him you have to do exercise, control diet. No, you give me some tablets. That I will take. I will take 5 tablets. But don't tell me to control on diet. Don't tell me to do exercise. Don't tell me to get up early in the morning. So I am not going to do anything. You just give me tablet. I want to lose weight.
We are part of a jhatpat generation.
Absolutely.
I don't call it the Z generation, but the jhatpat generation.
Yeah.
I mean, we want everything very quick.
Yeah.
And we are now part of an Instagram generation where everything has to be less than 1 minute.
Yeah. Doctor, I think we have got a call.
Okay. Sure.
Yeah.
Slide.
Hello.
Hello.
हाँ विचार.
डॉक्टर. हाय कोण येता?
हय विचार.
हाय होमिओपॅथीक हांव एलोपॅथीक वयताय आमी. आनी होमिओपॅथीक एलोपॅथीक कोता सणां वखदां. मोदें होमिओपॅथीक गेल्यार तेज उपेग येता आनी दुसरे म्हणजे ते आंगाचे कितें कोण कात लागता न्हू.
बरें. Okay, we got the point. Sir, the question is like this. She is asking that if a person is already on treatment,
yes,
from allopathic medicines,
yeah. Can one take homeopathy?
Can one take homeopathy?
Yes, one can. That's again a good question, Maria. And let me say it's a very, very common issue today because lots of the NCDs, patients who come to us, they're already on allopathic treatment. Now, there's something called drug dependency.
Absolutely.
So, for example, if you're taking a medicine for, let's say, just give an example of high blood pressure or diabetes, very simple. Okay. Now, your body gets used to it. Now, you cannot suddenly withdraw it. If you stop it suddenly, you will start getting a lot of, the effects will be much worse. And you can get into a serious problem. So, we never advise that you should do that. So, you actually have to take homeopathy and allopathy together. And you have to gradually taper your allopathic doses over a period of time. Now, that can take months and sometimes they can even take more than a year.
Achha.
So, you gradually taper down your medicine and you then depend only on homeopathy. And then ultimately, you also, stop homeopathy and then live a natural, full life. So that's how it works. And let me just again add this here saying that, this is a common myth where people have created saying that, allopathy and homeopathy are enemies and they can't get along together. We are today sitting 2 doctors on the same platform on a channel and, very happily laughing and smiling and talking about each other's virtues, and values, which every system of medicine brings. Absolutely. Let me mention here that we've experimented very successfully with integrated medicine. Yes. We have a Dr. Batra's clinic in Bahrain for the last, I don't know how many years now, 10 years or so, which is part of a large hospital chain. We partnered with a large bariatric clinic in India, where we treated patients post-surgery of depression and anxiety. Achha. Because they didn't want to put on weight. We are even part of an infertility clinic today in Greece, one of the largest, where when people who do not conceive, we are giving, particularly PCODs and all, we are giving them homeopathic treatment. So, and there was a whole research that was done in Athens, I remember many years ago, where they said if you're a diabetic and you're taking an oral anti-diabetic medicine, you can control your sugar by say 47%. If you add homeopathy to it, then the control becomes 97%.
Oh,
so you get a 50% additional benefit. Yeah. So this is a myth. So actually, with whatever you're taking, because you're taking it for a period of time, you cannot stop it suddenly. You have to continue with it. It has its own merits, but you don't want to take it forever. And you don't want to have side effects. So if you can move to a safer alternative gradually over a period of time, by tapering it down gradually, you will then find the right balance.
Absolutely. So, doctor, I'm really happy to hear this because you have added to my knowledge of because see what doctor has said, it is a synergistic activity. It is not only that one particular branch of medicine is working, means you cannot take, if you are taking allopathic medicines, you are not supposed to take homeopathy. It is nothing like that. On the contrary, what doctor has given along with the example, that he is taking those people who are diabetic and taking metformin, example, and if you take along with that a good consultation from a homeopath, and along with those medicines you are taking homeopathic medicine, the result is faster and better. And second question what doctor has nicely described की तुका कोंकणीन कळचें म्हणून सांगता की दोतोरान सांगला की होमिओपॅथीचे आणि ॲलोपॅथीचे किंवा खंयच्या दुसऱ्या ब्रांचीचे मेडिसिन तुम्ही बरोबर घेऊ शकता गरजेप्रमाणे. आणि दुसरे म्हणजे डोंट ट्राय टू बी, तुम्ही स्वतःचेर एक्सपेरिमेंट कर नाका, यू लिसन टू युअर डॉक्टर, बिकॉज फायनली दीस लायक सी इफ यू आर टेकिंग सम टॅबलेट्स फॉर युअर प्रेशरा खातीर जर तुम्ही गुळयो घेता तर एका दिसान प्रेशर सडनली तुमचो हें जावचो ना. सो ग्रॅज्युअली ते टेपरिंग करचें पडटलें अंडर मेडिकल सुपरविजन. सेम थिंग अलॉंग विथ डायबिटीज ऑर हायपरटेन्शन वॉट एवर मे बी युअर प्रॉब्लेम्स. सो ग्रॅज्युअली टेपरिंग करून सायड बाय सायड यू आर ऑल्सो टेकिंग होमिओपॅथिक ट्रिटमेंट, आणि हाचो दोगांयचो कंबायन इफेक्ट. सो आय विल रादर से दॅट इट इज नॉट इंडिपेंडंट or dependence, it is interdependence. For the interdependence that will give better result, better action. And in this approach, that's again I repeat, today's even allopathic medical textbooks have come up with our new syllabus is giving introduction to allopathy, Ayurveda, homeopathy, Unani, Siddha medicine, everything, because finally we have to work for the welfare of the society, for the well-being of, and you don't know which one will work. Sometimes we also know this particular medicine is the right medicine, but that person cannot digest it, or he is having side effects, or he is having problem. So definitely we should have some alternative available to serve this person and to get cured of his illness. सो ह्या दृष्टिकोनांतल्यान जेन्ना आमी होमिओपॅथी कडेन पळयता किंवा खंयच्याय ब्रांचे कडेन, तेन्ना एका व्यापक दृष्टिकोनांतल्यान पयलींच्या पेक्षा वेगळो आज हो दृष्टिकोन आसा. आणि डॉक्टर सांगता ते प्रमाणे एक गोष्ट म्हत्वाची आसा की आयचो आणि कालचे. डॉक्टर, आय वॉन्ट युअर कमेंट ऑन अ स्टेटमेंट. होमिओपॅथी 50 years back and homeopathy today, there has to be definitely a difference, because as it is not that, okay, it is not a static science, it is also developing science. There are also research activities going on. So sometimes people like say once as I will put it some hypothetical, like say I am taking some medicine, once upon a time we used to take 3 tablets, now I am taking only 1 tablet with the giving me same result, because some molecules have changed, some configuration has changed, maybe the basic component is same, but that has come out of research. Same thing with homeopathy. Am I right, doctor? You can add to this.
No, you're absolutely correct. And you know, when Dr. Samuel Hahnemann, the German MD doctor, a medical MD doctor who founded homeopathy more than 250 years ago, around that time there were hardly 200 basic medicines. Today there are more than 2,000 basic medicines.
Oh.
And all of these have been clinically proved and researched. And now there are a lot of double-blind trials which are being done on a lot of disorders like allergies, asthmas, arthritis, rheumatoid arthritis, and so on and so forth. So, as you said, I mean, it has evolved a lot. And today, a lot of it is based on clinical evidence, which is what we all believe. And so I think we can show the world that it actually works. Because you've got all, you know, you've got MRIs, you've got CT scans, you've got pathology reports, you've got blood, tests to show that the patient has actually improved. Earlier, while we still depend on symptoms for prescribing, but earlier that used to be the only criteria. So you really never knew what was happening inside the body. Today you actually know what's happening inside the body, and you also know that the body is talking to you through symptoms. And the symptoms are the first sign, you know. So you should listen to your body very carefully. It always tells you when something is going wrong. Just like how your engine, when you're driving and it makes a little noise, you know something is not correct. You know, when you're driving your car. So similarly with your body also, it will give you some signs where you get a little bit out of breath when you're walking, when you talk too fast, you cannot speak, you know. Something's happening, your speech gets a little slurred. Now that may be the beginning of a stroke, you know. So you have to really watch out for all these signs, and take care of your body and take care of yourself. I'm saying that is what is important.
Yes.
And so symptoms are always reflecting what is going inside the body, maybe something deeper. And that's what homeopathy believes and works on. So we treat according to symptoms, we treat according to personalities, you know. Not one drug suits everybody. We also believe in homeopathy a concept, as you mentioned, something called idiosyncrasy, which means that every person reacts in a different way. So we are treating the patient of hypertension and not the disease of hypertension.
Absolutely.
So for example, for migraine, we could have about 200 homeopathic medicines which could work. But what will suit you? Whether your migraine is associated with nausea or with vomiting, whether it's worse in the morning, whether it's associated with mental anxiety and so on and so forth, then they decide that the medicine is decided. Just to give you an example, for any ordinary chronic case, there can be 98,000 permutations and combinations for one patient.
Oh,
And now, of course, it's all computerized now. So you can actually press in symptoms and you can get the right answer, and then the doctor can decide, giving his experience and weightage, what medicine to select.
Achha.
But that's really how complex homeopathy is in that sense, and that's how exact it is.
Acha. So today, as you rightly mentioned, these are all configurations. A lot of new medicines have also come. They are giving better results. And as means in our earlier discussion, ki often people just don't pay much attention to their own body. You have rightly mentioned. See, whatever, like say, maybe right from the fever, cough, whatever it may be, sneezing, it is the body's response. It is not a disease by itself. It is a response. And then, whether see, underlying there is some cause. You have given a nice example. Ki saran sagla ki when we are driving and the गाडीचा जर आवाज change झाला, that means something is wrong with the engine or something is wrong somewhere. Whether it is the engine or whatever it may be, where it is, whatever is the component of the car. So same way, you should listen to our own body and get treated from the right person, because nowadays everything is online. We have got WhatsApp universities, people have got WhatsApp consultants, and doctors like goes sarke lakshan dorat ki there is no single, you cannot say that this particular medicine is applicable for everybody of hypertension or this particular medicine for fever. It is not like that. As per the case, as per your body composition and as per the pattern of your disorder, the treatment changes. Am I right, doctor?
Absolutely correct.
Yeah. So, doctor, another question I have got is from one young gentleman by name Tushar. His question is, doctor, I am having psoriasis. So, what is, I'm young, he's a young, working for a multinational company, 35 years gentleman, a little stressed because of his targets and all. His sleep is normal, diet is adequate, he's a non-vegetarian, and but sometimes he prefers veg, 50-50, sometimes he's veg, 50% of the days he's non-veg. And of late he's getting some patches on his scalp and on his body, which are dry, scaly lesions. And doctor, what is your recommendation on this?
So, this is not a very easy thing to advise on a television channel.
Yeah.
So let me be very honest about it. Because, psoriasis, first of all, there are very many different types of psoriasis, clinically.
Yeah.
It's just not one. Okay, you get gutty psoriasis, for example, then of course, by and large, all of them are scaly. Sometimes they have a discharge with an offensive smell. They scratch and itch a lot. You can get psoriasis of the scalp, which is very common. And you have to then differentiate it from seborrheic dermatitis, which is like dandruff. So they're two different things. But, so first of all, getting it correctly diagnosed is very important.
Yeah.
Second thing is it's an autoimmune disorder. So it comes because of low immunity. Now, immunity can become low because of various reasons.
Yeah.
One of them, of course, is stress.
Yeah.
So I've seen with my practice that a lot of patients who get psoriasis get it as a result of continuous stress. It's not sudden stress. It's not that, okay, somebody died and then I got it.
Achha.
Not because of that. But like you said, this gentleman, Tushar, has got targets which, he's had to, regularly fulfill and work on. So there's a continuous stress. So whenever there's a continuous stress, then the skin is a mirror of your emotions. It erupts. Okay, so it shows up, and one of the forms in which it shows up is psoriasis. So what can you do to really self-treat yourself, if at all? First of all, you can't self-treat yourself, because like I said, it's a complex thing, and there can't be one single medicine for it. But what you can do is, number one is you have to control your mind. And you have to do some kind of meditation, breathing techniques to make sure you're not anxious, so that it doesn't, get into your skin. That's the first thing that you can do. Second thing is that you should use a glycerine soap, okay, because that is something that will help your scales to kind of come down. Probably it'll get worse in winter, whenever there's a dryness in the climate. So using a glycerine soap will help you. That's the second thing that you can do. You can use a kind of a non-medicated oil as well to keep it soft. Let me say that it's good, sometimes very helpful to temporarily use ointments, because it kind of suppresses it. But it's not the cure, because it keeps coming back again and again. And that's not an answer, and that's not what I recommend, unless in very, very adverse circumstances. So I think these are the things that you can easily do. As far as your diet is concerned, low protein diet actually helps psoriasis very much. So not taking non-vegetarian food, turning vegetarian, vegan will actually make a lot of difference on your skin. So I think giving you these few, and of course if you sleep well, that also helps, because Lots of people, for one of my books that I was writing, 13 Steps to Bloody Good Health, about 3 months ago with Ashwin Sanghi, 3 years ago, I realized that more than 90% of people in India are sleep deprived.
Oh.
And this was before COVID. So,
Achha.
Sleep has a very, very strong effect on the human body and on diseases, and we don't realize it. So again, if because of your targets, you're not sleeping well, you're getting up in the night, you keep thinking of figures and numbers all the time, you're likely to then not get well. So getting proper sleep, eating vegetarian food, mentally relaxing, and using some kind of non-chemical soap on your body are things that will help you.
Achha. Thank you, doctor. I think you have got, he has got the answer, and I'm sure along with that you can consult your homeopath or whoever you feel right and follow the advice. Doctor, I got one other question from Ranjana. She is 40 years old, working for a multinational company. Her office is AC, and she is having allergic rhinitis. In a nutshell, I just compiled this question. What is your take on this? Because she's suffering from this. She's taking antihistaminics for quite a long time, including the sprays and the tablets. But she's getting temporary relief, and then again the thing goes on, and she is now practically she's saying, I'm fed up.
Yeah, so Ranjana, this is one of the problems which really is not really a disease problem, but a nuisance problem. Because can you imagine, sneezing all your way out is so embarrassing. It also makes you feel weak, tires you out. Being on antihistamines for a long time may cause you drowsiness, may interfere in the capability of your work as well. So I think it's good that you find a kind of permanent solution to your problem. Now, what really is an allergy? According to homeopathy, an allergy is an exaggerated response to something which is normal for other people. So for example, if there are 2 people in this studio and one of us is allergic to dust, if there's a little bit of dust or somebody stamps the carpet, then that person will start getting sneezing.
Absolutely.
The person who's not allergic, nothing will happen. Absolutely. So these are called allergens. And some of them are known and some of them are unknown. So, of course, if it's a known allergen, you avoid it, you're happy. But what do you do with unknown allergens? So, with homeopathy, you can build immunity against known allergens, and you can build general immunity. So, the moment you do this, then you're not sensitive to whatever is the environment. You're not sensitive to what you're eating, you're not sensitive, you don't overreact. So, the answer really is to build immunity and to lower sensitivity, not the other way around. Because within an allergy, your immunity is low and your sensitivity is high. And very often this also is related with emotional sensitivity. People who get allergic rhinitis and allergies, a lot of them are also emotionally very, very, easily get upset, get angry easily, are emotional. Sometimes they start crying easily. They are very sensitive. So it also tells on the physical part of their body. You should go to a homeopath and get yourself treated constitutionally. I'm sure that you will get well and you will be able to gradually get off all your antihistamines and then find a cure for your allergy. Again, let me mention that there are two sides to the same coin. One is the validity of the allergen. So if it's very strong, if the atmosphere is loaded with allergens, with everything allergens, then no matter what you take, you're still going to fall sick. And on the other hand, if your immunity is high and the atmosphere is reasonably okay, then you're not going to fall sick.
Correct.
So I think that's the level of comfort that you can have with your allergy. And today, even in our clinics, we do lots of allergy tests where you just take 1 drop of blood and within 20 minutes you get a result. It's imported from UK, and within 20 minutes you can come to know almost 40-50 items that you could be allergic to. So of course, avoidance is one of the best forms, because a lot of time we don't know what we're allergic to. But if you know, for example, you're allergic to protein or dal, you just don't eat dal in your food and your allergy will disappear. It's as simple as that.
अच्छा. Okay, I think thank you very much, sir. डॉक्टरांनी बरंच सगळ्या मस्तपैकी इतके सुंदर रितीन एक्सप्लेन करून सांगितलं आसा की हाचे सगळे म्हणजे कारणां कितें आसा एलर्जीची आनी ताचे ट्रिटमेंट कितें जावं शकता. तुमी बऱ्याचशा डॉक्टराक वचून मेळून ताचो एडवायस घेवन हाचेर तुमचे मात करूं येता. डॉक्टर, आय हॅव गॉट वन क्वेश्चन फ्रॉम 145-year, I'll definitely say a young lady who is having perimenopausal syndrome according to her, but and she has also added, I'm nearing my menopause, so a lot of hot flushes and or related activities, So how can I manage this situation? And I get anxious, I get tense, and she's worried also, and somehow she's feeling that she is not keeping fit for the daily day-to-day activities.
Yeah, so again, this is a hormonal problem, and I would say that you're too young at 45 to actually get menopause. But today I've seen lots of young ladies, and I'm sure, doctor, you can corroborate that, because at a younger ages, people are now getting menopausal.
Correct.
During my time when I studied medicine, when people were 55, 60, and when women were 55, 60, that's the age when they really used to get menopausal, and then that is the time when they used to get hormonal these changes because of levels of estrogen, changing. You started getting hot flushes, you get excessive sweating, nightly sweats. So these are all common symptoms. There are some very good homeopathic medicines also help you to treat anxiety. They are non-hormonal, they have no side effects. But again, you'll have to visit a clinic and
get properly
evaluated and treated from a qualified homeopath.
Yeah. Doctor, in fact, I would like to just add, I have one patient who, mother is still getting her periods, and daughter is undergone menopause.
My God, wow.
So this, and in fact, we were quite surprised, but and nowadays, you must also observe that menarche age has come down.
Yes.
By 10, 12 years, everybody is into full swing. And even the menopause is coming a little missing.
Yeah, they are starting early and finishing early.
Yeah, starting early and finishing.
Yeah.
Doctor, we got a call, I think. Hello.
Okay.
Hello.
हाँ.
दोतोर मुझे मातशें आनी एक क्वेश्चन उरलोलें.
विचार.
होमिओपॅथीक कोता आसतना म्हाका एक पाटी दोतोर सांगतालो तेका पोत आहा लसूण, कॉफी, तेल ह्यो वस्तू खावपा जायनाय कांदो. आतां हे दोतोरागे वखदाचेरी म्हाका कोडपा जाय आसलोलें सगळें कोंता येता ह्यो वस्तू खावपा न्हू.
बरें, very good question.
आनी दुसरें म्हणजे एक हाडां हाडताय अड्राटायज तेकाय वखद बऱ्या पडटा होमिओपॅथीक. हे दोन मातशें सांग. देव बरें करूं.
Okay. Doctor, we have got two questions from this lady. One is often when it means when you go to homeopath, the advice diet, avoiding
not have coffee,
garlic and all these spices. So what at coffee? She has mentioned I think very much that she must have visited a homeopath.
I could hear that. Yeah.
So what is your take on this? And second thing about the joints pain. Then doctor has advised knee joint replacement, all this type of associated disorders. Whether homeopathy works and how is the line of management? Okay,
so let me answer the second question first, because arthritis is a very, very common problem in old age, and again it depends. There are two very common types of arthritis. There are many, but I'm only talking about two. One is osteoarthritis, where because of aging, the kind of major joints give way. Because it's like a wear and tear. Yes. So the older you get, the more weight your body has, which falls on the knees, the more likely you're to degenerate and get problems. The other one is rheumatoid arthritis, which affects the smaller joints but also disfigures them, and it happens also in young people. And that is because of lowered immunity. It's an autoimmune disorder.
I see.
Basically. So in one you have to build immunity, in the other you have to check deterioration. Now, what are the commonest symptoms that you get? The number one is stiffness and mobility problems. So pain and mobility are the two commonest problems in arthritis. Now with homeopathy you can treat both up to a point with no side effects. So that's how homeopathy can help you. So, and there are a lot of clinical trials that have happened. The normal thing is NSAIDs, as we call it, which is non-steroid anti-inflammatory drugs, which are used, but they still have side effects of hyperacidity being the commonest, and many others also. But versus that, homeopathy gives quicker, faster results and no side effects. No hyperacidity, no nothing. So I would really recommend that. And of course, you have to look at what is causing it. Are you overweight? If you're overweight, you have to lose weight, because the whole body weight is going on the knees.
Absolutely.
That's a load-bearing structure. So it's not going to get all right with any medicine unless you actually lose weight.
Absolutely.
Also very simple things like, doing quadricep exercises, for your thighs. You just raise your legs like this so that this becomes strong. When this becomes strong, not the arms, but on the thighs, then the body weight is taken up by the muscles and it doesn't fall directly on the knee joint. So these are simple things that you can do. Now coming back to your first question, which is regarding the diet restriction. Dr. Samuel Hahnemann, who founded homeopathy, again German doctor, he said every man's stomach is like his foot. So what he meant by that was that he was against universal diets. So actually there is no diet in homeopathy at all. Any diet in homeopathy that you have only depends on you as a person, if you are allergic to some things and something don't suit you, or it depends on the disease. So for example, if you're getting, rheumatoid arthritis or arthritis, maybe the doctor will tell you कि खट्टा नहीं खाओ, नींबू नहीं खाओ, or will tell you that ठंडी चीज नहीं लो, because it may aggravate your problem. So disease wise, you have to be careful with diet. But when you are on homeopathic treatment, you can take whatever you like. I mean, this is a very old myth.
Yeah.
I mean, you see, because homeopathy works irrespective of whether you take coffee or tea or whatever. The only thing what we recommend is that adha ghanta before and after the medicine, don't eat or drink anything.
Oh.
Just keep, because homeopathic medicines work through the oral way. Yeah. So we've got all the sensitivities, all the nerve endings. The maximum nerve endings are under the tongue. That's why we say that when you take homeopathic medicine, you put it under your tongue and you suck it. So that's when it acts best.
Achha.
But there is no, today there are so many other forms of taking homeopathic medicine. I mean, you can take it orally, of course, you can take it also through injections now. I mean, there's a cancer treatment that is there in Switzerland, which is based on injections. So you take a homeopathic plant and you inject it into your system. So, I mean, this is how, like you said, homeopathy has changed over the years.
Absolutely.
I'm saying you get nasal sprays in homeopathy now. You get roll-ons in homeopathy. You get sprays for pain, like arnica sprays where you can actually use it. You get balms which are based with homeopathic medicines. So today you get a variety of different ways through which you can actually absorb or get the benefit from homeopathy. So there's no need now to worry about any diet restrictions at all. You can live your life. I think one of the biggest things about homeopathy is that it adds quality of human life.
Absolutely.
So what we believe as doctors is that we don't want you to restrict your life. We want you to enjoy your life.
Absolutely.
We want you to continue doing whatever you're doing and with happiness.
Yes, absolutely. Doctor, means in that case, I will give your example as well, because we should not live like bonsai plants, but live in a full-fledged plants with all our branches and all our roots and breathing atmosphere in and out freely and living happily. As a person, as a human being, apart from being a physician or a homeopath, you have been into so many activities, like you are into anchoring, you are into singing, you are into photography, you are into philanthropy. So many activities you are doing. And in fact, it is what I observed the moment we met for the first time. You had that very pleasant smile. That itself is a very encouraging and inspiring.
For that, I have to thank my dentist.
Doctor, in that case, I will just ask you, what is your treatment of homeopathy for your any dental problem? Is there anything available?
So, I think one thing that we must understand is that, because it's been restricted in a way with allopathy and associated, but actually it's a different system of medicine altogether. So dentistry, for example, even gynec and obstetrics, and surgery are kind of branches of medicine generally, not just of allopathy.
Absolutely.
What is different is the treatment. So instead of giving antibiotic, if you can actually give a homeopathic medicine, it can work. But there are so many problems where you will need dental treatment. So you have to go for it. There are so many diseases also where you need surgery.
Absolutely.
But what we are against is elective surgery. I mean, if you can avoid surgery, like for example, if you have a nasal polyp, if you've got warts, if you have certain kinds of kidney stones, gallstones, do you really need to remove your organs or not? That's what we kind of question. And we believe that with homeopathic treatment, you can actually save a lot of surgeries. They're not required. So just because something is not known in one system of medicine doesn't mean that it cannot act in another system of medicine.
Absolutely.
So you must at least try it. So all these, as a matter, let me also mention here that, in Europe particularly and even abroad, homeopathy is a super specialization. So you get cardiologists who are homeopaths.
I see.
So they will use whatever they have to do, but they will also give you medicines for the heart, homeopathic medicines.
Absolutely.
You've got dentists who are homeopaths. So you'll do dental surgery, but they will not give an antibiotic. They'll give you arnica, simple medicine to get rid of the pain.
Doctor, I'm just sorry to interrupt. I think we are getting one call and they are on the line. Hello.
Hello, doctor. Doctor, good evening. And I know that homeopathic is the best medicine for kidney stones.
Okay.
Now I want to know about gallbladder stone which I am having.
Okay.
So what to take now?
Thanks for the question.
So thank you for the question. Again, like I said, we cannot prescribe on television studios and channels, and otherwise then we'll also become like WhatsApp Academy, as Sir said. So, but yes, I'm saying it really depends on the number of stones that you have, and depends on how they're impacted. Again, with kidney stones also, it really depends on how large they are. It depends on whether they're in the lower part of the kidney, lower calyx, or the upper calyx. Because in the upper calyx, they come out easier because they come out with gravity.
Yeah.
In the lower calyx, they have to come out against gravity. So it's even more difficult. Again, if they are in the bladder, the stones come out easily. So similarly with gallstones, a lot of it has to do with high cholesterol and a lot of fatty food that you eat. So I think if you reverse your diet, but always remember that in case it gets impacted, then it will stop the bile flow, and you will then get jaundice.
Yeah.
So that's the risk that you are taking. So I would recommend that you do go to a homeopathic doctor, check out what are the number of stones, what are the sizes, how they are placed, and if it is still safe to continue treatment over a 6-month period, do it. Check again. If they are dissolving and become smaller, continue the treatment, but always be alert, knowing that there is always a chance that you could get into a case of emergency jaundice.
Yeah. So you can get into obstructive jaundice and it can cause a problem. So absolutely, Mukesh doctor has really खूप बऱ्या पद्धतीने सांगितलं. Yeah.
Doctor, last 6 months I'm taking treatment from homeopathic, and no this thing.
Have you checked the size, whether it is same or it is?
Yeah, it's the same.
Yeah, so I already told you that if it's not helping, then you either need to change your system of medicine or you need to change your doctor. It's as simple as that, because it has to work, and 6 months is a good enough time to get some change. I mean, but like I said,
Having a branch in Goa?
Sometimes, yes, we have two, and you can go on our website www.drbatras.com and take all details if you need to.
Okay. Thanks, doctor.
Thank you.
So, sir, you have really given a very good information, elaborate information, and as you have rightly said, we are not in favor of one particular branch, but whole. We always say that Sarve Bhavantu Sukhina, or when we pray, we say that Om Sahanavatu Sahana Bhunaktu Sahaviryan Karavavahe Tejasvina Vaditamastu Ma Vidvisha Om Shanti Shanti. Means let everybody come together, all the people with like-minded thoughts, vision, perception, medical help, whatever, so that the community at large gets the benefit. It is not that I am stronger or I am superior, without being jealous of each other. Means even this prayer is there right from the beginning. So people have already predicted that if jealousy is there in the man's mind, in the heart. So definitely to cope up with that and keep it aside. When we are talking in the interest of the public, we have to work together with synergistic activities, symbiosis, or whatever say. Sir, we are almost on a finishing line, and I would like you to give the final take-home message. Okay, just before that, sir, I think we got a call. Hello?
Hello.
Yeah.
I'm सायकल उलयता डॉक्टर. म्हाका खूप हेअर फॉल जाता आणि हेअर थिनिंग जाता आणि एकाच सायडींतल्यान चड हेअर फॉल जाता. सो त्याच्या खातीर आनी कितें?
बरें, तुजें एज कितें? What is your age? पिराय कितली?
24 years.
Okay, this is a 24-year-old girl, young girl. I should not say old girl. Okay, young girl. On one side, she is saying she is feeling more.
Left side in third hair fall जाता as compared to right.
Okay. And कितें करता तू?
I already.
हांव शिकता.
Okay.
Studying fellowship.
Yeah. Okay.
Yeah. So congratulations and best wishes for your fellowship. I'm sure you will do well. But I've already answered this question of hair fall in the beginning of the talk when I addressed Reshma's question. There are different reasons for hair falling, and there are more than 40 different medical reasons. So you really need to visit a clinic and consult a qualified doctor rather than self-treat yourself.
So
like it could be nutritional, it could be because of iron deficiency, it can be because of PCOD. So you have to actually check it out first before you actually start any treatment.
Okay, doctor, since she has asked, she's saying that it is more on one side. Is something like that anything possible? Like she's saying it is more on the left side than the right side.
I mean, it can. I mean, the human body is very peculiar. So you never know what everybody is different.
Yeah.
But whether it's a medical condition or not, no. So it's not part of a medical condition, because alopecia areata can be on one side, and that can be a medical condition where you lose hair in patches. But if it's not in patches and it's what you call CT,
we'll have to work out in a different pattern.
Then it's not, it's probably coincidence. The other thing I can also think of, just came to my mind, is something called traction alopecia. So what happens is if you're sleeping on one side of the bed, then because of the pressure that you're getting of a particular, people, they tie their ponytails, or they tie, the hair too tightly on one side, then it's possibility that you could be losing hair from one side.
Achha. So, doctor, I have left a ball in your court to give the final remarks and conclude this function. Before that, I must really thank you on behalf of all our viewers. I know though there were no questions because people are engrossed in listening to you. Again, on behalf of all the viewers in Prudent Media, I thank you very much for spending your precious time and joining us for this Hello Dotor. In fact, you have raised our standard because now we are having international faculty, expert, international renowned personality, an author, a multifaceted personality, a Padma Shri awardee, a doctor, which is addressing in our program. That is really, in fact, it is encouraging and charging me as along with other viewers also. And I thank all my Prudent team for taking all the efforts to get you online and go this program flawlessly. So, doctor,
thank you very much, and thank you for having me here. I'm so grateful. Let me just end by just humming 2 lines of a Kishore Kumar number, and which is my vision for a happier and a healthier world.
Yeah.
And I sing this for my grandson, and if he's somewhere listening, good luck, enjoy it. आ चल के तुझे मैं लेके चलूं एक ऐसे गगन के तले, जहाँ गम भी न हो, आंसू भी न हो, बस प्यार ही प्यार पले, एक ऐसे गगन के तले, एक ऐसे गगन के तले, एक ऐसे गगन के तले. For this wish of good health and happiness for all of us. Namaskar and Jai Hind.
Thank you. तुमकां सगळ्यांक काळजान संदेव बरें करूं. तुम्ही हो प्रोग्राम असोच पळयत रावचो. तुमचे आमचे प्रश्न आमचे बरोबर तुम्ही शेअर करचे आणि ह्या कारवाईचे मोहीम आनी व्यापक करची आणि आमी आनी तरेतरेच्या विशयांचेर शिकचे. ही व्यापक मोहीम नदरेन दवरून तुमकां सगळ्यांक काळजान संदेव बरें करूं. नमस्कार.
तुम्ही पळयतात प्रुडंट. You're watching Prudent.
The all-new Prudent app is here. Watch news videos and bulletins on the go.